Um, One of my sayings is rest is best. So teens need enough sleep. We have a poll popping up now about struggling with sleep. And I'm super interested in the answers to this because my gut is they're going to be pretty mixed between some are sleeping too much and some are not sleeping enough. Sleeping too much is typically a reaction to being depressed, but the sleeping not enough is often a trigger. And so depression can cause sleep disruption in many ways. And getting that disrupted sleep back on track is one great way to just at least give the teen the maximum possibility to regulate their mood best. And we know this as adults. When we're tired, like when we are tired and dysregulated, we are not coping well. Like we are not focusing, we're not on task, we're more irritable. And so we want to think about what we can do to get enough sleep and not too much. Couple basics of sleep hygiene. Okay, here we go. So we have pretty even split. So some folks are like, I'm not answering. Only 10% are like, my teen gets the right amount of sleep. But otherwise, it's kind of split. Some are saying, a lot are saying they don't sleep enough. Okay, so this is good. And then some sleeping too much, which is usually a sign of needing some other strategies in their life. So I'm going to talk a little bit. It's going to sound a little bit more like the kids who don't sleep enough. Regular bedtime, and we can talk about parenting strategies at the end, but regular bedtime means a window, and the window should be similar weekdays and weekends. There's a bit of a habit we get into where when we don't get enough sleep during the week, we then nap or sleep 12 or 14 hours on the weekend. And if your teen is doing well and that's their sleep rhythm, more power to them. Like sleep, if it works for you, it works for you. But if your teen is not doing well, then getting that sleep rhythm back into something that's a little bit more consistent is one tool. So a regular bedtime, this is the least favorite thing that teens want to hear, but it's true. We have to get off our screens for a period of time before bed to just give our brain a chance to quiet down enough to give us a fighting chance of falling asleep. And so a bedtime routine that includes even 15 or 20 minutes of reading an actual book, listening to music, showering, stretching, but something that does not involve being on their screen really helps your brain settle down. Divvying up the room. So teens like to spend a lot of time in their room. They like to spend a little time on their bed. But one of the things about disrupted sleep and not sleeping enough is the body not knowing the difference between when I'm supposed to sleep and when I'm supposed to do other things. And so practicing the skill of if you're going to be on your screen or you're going to be doing homework, at least be out of your bed, even be on your floor. I would be okay with if we can try to get out of the bed and use the bed really just for sleeping. And napping, this is my least, like, teens hate this conversation, and so I saw some notes out there being like, "Teens aren't gonna do this." I'm still telling you what best practices are. Some teens can work on this. Sometimes they're willing to try the no screen time before bed. Actually, Pew Research had a study out this week showing that 45% of teens believe that social media and internet use is bad for their mental health and bad for their friends' mental health. And that's almost double what it was 2 years ago. 2 years ago, it was something like 22 or 23%. And so teens are increasingly recognizing the impact of their devices on their own well-being. So I think we are entering a stage where we might have a little bit more of a hook for this. Napping is the death knell for sleep. The body relies on something called sleep debt, meaning like it's been enough time since I've been asleep, like 8 to 10 hours since I was asleep, that my body is now tired enough, even if I'm chronically sleep deprived, tired enough to go back to sleep. And so cutting out napping is one of the ways we can increase the odds of getting good sleep at night.